The treatment of ovarian cysts really comes down to two options. One is to wait it out and see if the cyst goes away, and the other is surgery. So let's talk about those two options and when it's appropriate to do one versus the other. And as far as surgery goes, what are your surgical options? But before that, I just want to mention one thing briefly, is that many people will treat ovarian cysts with birth control pills. The truth is that when you look at the studies, birth control pills won't make a cyst go away. Now, it is true that birth control pills can stop a cyst from forming in the future, so it can prevent the next cyst from forming, but it won't get rid of an existing cyst, although there's a lot of confusion about this, and many doctors will prescribe it for treating current cysts. But just so you know that that's out there. So when is it appropriate to do nothing and just wait for a cyst to go away? Well, it really has to do with the type of cyst. So in a woman that still is having her periods, in a premenopausal woman, a cyst that's less than 5 centimeters is generally safe to watch, and most of those will go away on their own. Now, there are certain types of cysts, particularly if something looks like what they call a dermoid cyst, where that may not be appropriate. But in general, it's usually appropriate under 5 centimeters to just watch that cyst and do serial ultrasounds and watch it go away. Now, cysts greater than 10 centimeters, those always need treatment. So if you have a cyst that's greater than 10 centimeters, it doesn't matter what that cyst looks like, that really needs to be treated, and that's going to require surgery. So there's a spot in between 5 centimeters and 10 centimeters where it may be appropriate to watch, or it may need surgery. And that really is something that's going to depend on the quality of the cyst, on how you feel, and a conversation with your doctor. But that's a sort of middle zone between 5 and 10 centimeters. So if you're going to treat a cyst with surgery, how is that going to be done? And there's really two big picture options here. One is what's called a laparoscopic surgery, and that's where a small incision is made in the belly button and a camera is placed through that, and 2 other little holes are placed in the abdomen, and the cyst can be removed through these small holes using the camera. That's a very nice way to do things because it's typically outpatient, meaning you can go home the same day, and the recovery is pretty minor. Now, the other way to treat a cyst is with an open approach, where a larger incision is made in the abdomen, the ovary is then pulled up, and the cyst is removed. The disadvantage of that is it requires a hospital stay, usually a couple of nights, and it's going to require some significant recovery time, up to a month or even 6 weeks, depending on how large that incision is. So why would we ever do an open procedure? Well, it depends on the cyst. If spillage of the cyst is not acceptable, in other words, if the cyst fluid could be toxic to you if it spills, it may be best to do it open. And that's because there's always a risk of cyst spillage whenever you're doing this type of surgery, and that risk is greater with the laparoscopic approach. So in some types of cancer, or in some cysts like dermoid cysts, it may be best to do that open. Now, in a dermoid cyst, for instance, where you want to make sure there's not spillage, if you're willing to give up the ovary, it's usually pretty easy to take the ovary out and then remove everything in one package. But if you're trying to remove the cyst off the ovary, that's a little bit trickier, and through the laparoscopic approach, has a pretty high risk that that fluid inside the cyst will spill. And so in those cases, it may be more appropriate to use an open approach to keep the fluid from spilling, which can cause problems for you down the road. So those are the kind of things that will be discussed between you and your doctor, and the kind of things that your doctor will be thinking about as to what approach to recommend for you for surgery. Laparoscopic approach is a lot easier for recovery, a lot less pain, less time in the hospital, but sometimes not as easy to get the cyst off the ovary without spilling the cyst. An open approach, a little bit safer as far as being able to remove the cyst off the ovary, but a lot more recovery and time in the hospital. So those are the things that you want to talk to your doctor about when planning for surgery. So again, big picture with ovarian cysts, it's very often appropriate to do nothing and just follow this with time and do serial ultrasounds and see that the cyst, what we call, regresses or goes away, or it may be necessary to do surgery, and those are really your two big options for treating ovarian cysts.